Teresa Lazars is a married mom of four, a teacher, and a world traveler.
We spent a lot of time traveling the world. We loved to sail, scuba dive.
Teresa had gone faithfully every year for a mammogram, and every year she would get called back for an immediate follow-up. Nothing ever went further than that. Until last summer, the outcome was different. She received a phone call from her doctor.
He said, you need to go and have a second mammogram. And I said, oh, of course. Why are you calling me? I always do this every year. And he said, no, this time it's the real deal. You have cancer.
I was sitting away from it, and I'm not sure I heard clearly, but her reaction right away, I knew that this was a big problem. And I knew that what we had to do now was find out how serious this was.
So I was shocked.
Teresa and her husband went to Penn State Health Breast Center for additional images, and a biopsy confirmed the diagnosis.
And they just told us that it's the worst possible news we can give you. And they said, you know, you have cancer. And I said, well, I can't do this right now. I said, I have to go to the Bahamas.
Teresa's family already had a trip planned, so she kept her plans and decided to start treatment when she returned. While in the Bahamas, a seashell she found, resembling a chest, became a sign that everything was going to be fine.
The one breast looked like it's off and the other one's on, and it washed up to my feet. I said, it's a sign I'm going to be okay. I took that every day to my cancer treatments.
Her stage was not a stage 4, so when we are a stage 2 or stage 3, we are looking at attaining a cure. And we are talking about doing chemotherapy first to try and shrink the tumor as much as we can.
I would be there for hours and hours. And when you go for the treatment, you always have your blood work done, and then you see the doctor, and then you have your treatment. So you're there a long time, a good portion of the day.
Treatment took a lot of time and also had a lot of side effects. Her family was a constant support.
Sometimes I just wanted to give up. I just did. I was so sick. But they would say, we're going to fight it together, you know. So we did.
The treatment itself was kind of brutal, and she was up and down with her own psyche. And so I kind of followed that too. But I tried to all the time say, you can do this. You're a tough person. Let's do this together. Don't give up.
Teresa's brother even came to her rescue at one appointment.
He came with me, and I had forgotten my ball cap. So he and I got to the hospital. We ran to the gift shop, and we bought ourselves matching ball caps.
After 6 cycles, she got that one infusion every 3 weeks. After 6 cycles, we were able to take her to surgery.
And by doing that, we were actually able to completely get rid of the cancer even before surgery.
Teresa would now have breast conservation surgery, an option to a mastectomy and an outpatient procedure.
We were then able to do breast conservation for her, a lumpectomy, as well as check her lymph node, which had no cancer. And of course, she actually had no cancer left in her breast either.
And I really didn't have any issues. I didn't really have serious pain issues, and it healed very, very quickly.
Her next step, radiation therapy.
In order to make sure there aren't any little cancer cells that could still be in the breast, the radiation is an insurance policy for those.
This experience has given Teresa inspiration to see more of the world with her family.
I quickly made arrangements just to get away for 2.5 weeks. I'm going back to Croatia.
I could see a light at the end of the tunnel, I guess I would say. Things are looking better.
Teresa and her doctors have a message for other women.
Anyone who has cancer knows that once you have cancer, you are always looking over your shoulder, always.
Go ahead and get your mammograms. I know it is, again, a scary moment if you get a call back, but this is where we can change the outcome. We can make a difference. We can catch it early, and you will also have an outcome like Teresa.
Teresa says the only thing she misses about her chemo appointments is the amazing staff that she now calls friends. Back to you, Deborah.
Thanks, Denise. Joining us is Dr. Melody Polishak, breast surgeon at Penn State Health Breast Center, and also Teresa's surgeon. Thanks for being with us.
Thanks for having me.
Let's talk about the team approach for breast cancer treatment at Penn State Health. Why is that so important?
There are so many aspects to treating the whole patient with a breast cancer diagnosis. So Penn State Health, we really collaborate from radiology, pathology, navigation, medical oncology, surgery, radiation oncology, so on and so forth, all the way through to survivorship so that we can really tailor our care to that individual patient. And we also want our patients to know that they have that whole team behind them.